Hi, everybody, and welcome to those of you who are joining us around Australia and around the world. Welcome to Curtin University's annual Human Rights Lecture for 2022. My name's Lisa Hartley, and I'm the co-director of the Centre for Human Rights Education here at Curtin University, and I'm going to be your moderator for today's live stream. This is the third time that we've been hosting this event online, and I'm sure you can all appreciate the COVID-19 pandemic continues to present with a number of challenges in the way that we live our lives, and we're continuing this online format for today's lecture. Before we start, I'd like to acknowledge that we are live streaming today on the traditional lands of the Whadjuk people of the Noongar Nation and pay our respects to their elders past and present. So since 2016, the Centre for Human Rights Education has hosted this lecture, and we've had some phenomenal speakers, and today is absolutely no exception. The Centre for Human Rights Education is a research, teaching and advocacy centre, and we focus on a range of human rights issues. We also offer a Master of Human Rights, and so if you're interested, please have a look at the Human Rights Curtin University website for more information. This annual Human Rights Lecture was established to encourage a really strong human rights culture both within and outside of Curtin University. And as a centre, we believe that the ideals of human rights are not unique to Western cultures and political and legal systems, but are present in major religious cultural political systems as an expression of the essence of our common humanity. This is also a vision of human rights that elevates the lived experiences of others as a vital source of knowledge from which we can learn and consider how best we live together. And so it's incredibly timely then that today's speaker, Samantha Connor, will be elevating her own voice as a disabled person and a fierce advocate for the rights of people with disability to be included in everyday life in the context of the COVID-19 pandemic. Before this, we have a welcome to country from Noongar Elder Professor Simon Forrest, and then a message from Vice-Chancellor to introduce our speaker. And then there will be an opportunity for questions and answers. So I'd like to now introduce Noongar Elder, Emeritus Professor Simon Forrest, to deliver a welcome to country message.
Thank you for the opportunity to deliver this welcome to country. Kaya Wanju, Nanquel Simon Forrest Burungu. I'm a Whadjuk Baladong Noongar with kin connections to Yamaji and Wangata peoples. Kaya Wanju Nija Whadjuk Noongar Budja, Waran Monat Budja. Hello and welcome to this place, the land of the Whadjuk Noongar on the Swan Coastal Plain and east beyond Karamurda, or the Black Hills to the east. We are the people of this land, the people of the crow and the white cockatoo. Kaya Wanju, Curtin University, Nija Katanini, this place of learning. I am of this land and place. I was born to this land. I follow a bloodline of people who have lived and walked and cared for this land we know as Whadjuk Noongar Budja for over 1,000 generations. Our culture and knowledge of this place continues today, even after the interruptions of the last 193 years. First Nations people from around the world refer to Aboriginal Australians as the first of the first peoples, the firstborn of all peoples, the oldest continuing culture and knowledge system on this planet. As human beings living on planet Earth, we are all in a sense custodians of Mother Earth while we are here. Mother Earth has a lot to say if you are willing to listen. However, we are the very first Australians and the first and continuing custodians of this land, Australia, which was, is and always will be Aboriginal land. Our country is one of the most culturally diverse nations on this planet, and it is the cultural diversity that makes Australia a wonderful place to live. I, as an Aboriginal Australian, as a first Australian, embrace the cultural diversity of our nation, and in particular, especially welcome people that have come to this country as refugees. All of us here present and beyond this place, we are here due to what has happened in the past. We are a consequence of what has gone before us. All Australians should seek to learn and understand the truth of our shared history. The contact shared history between Australia's First Nations people and those that came later has never been good. We have never had the recognition we seek. More recent indications of those uneasy truths and absence of recognition was Australia's unwillingness in 2005 to sign and endorse the United Nations Declaration on the Rights of Indigenous Peoples, together with 3 other countries collectively known as Kansas, Canada, Australia, New Zealand and the United States all refused to sign. And Australia was the last United Nations country to sign and endorse the declaration in 2009. On the 13th of February 2008, Prime Minister Kevin Rudd gave an apology to the stolen generation. And in part, he said, "We, the Parliament of Australia, respectfully request that this apology be received in the spirit in which it is offered." This sentiment of receiving in the spirit in which it was offered was not reciprocated to us when the Uluru Statement was presented to the Parliament of Australia. It was initially dismissed with radical negative responses by many of Australia's political leaders. This is only 5 years ago. Things hopefully have changed since then. One of the first things Anthony Albanese said in his victory speech on election night was, "Together we can embrace the Uluru Statement from the heart. We can answer its patient, gracious call for a voice enshrined in our Constitution." The decision to change or amend our Constitution is ultimately up to the non-Aboriginal population of Australia, not us. Once again, non-Aboriginal people will be deciding about us, to give us the recognition and a voice in the Constitution that we have never, ever had. We have had atrocious deeds done to us as part of the colonial experience, and racist legislation and government policy applied to us. But we as First Nations people have never had a genuine voice to legislators about decisions that affect us. 2 attempts in the past at a voice, realistically more a murmur than a voice to Parliament, have both failed because governments giveth and other governments taketh away. Hence the need for a constitutional voice. You, the majority of non-Aboriginal Australians here and listening to this, have a once-in-a-lifetime opportunity to change the course of our nation's history. You have a chance to give First Nations people of this country an opportunity of real self-determination, constitutional recognition through a voice to Parliament. I ask all of you listening to reciprocate to my welcome by requesting that you and everyone in your sphere of influence, your colleagues, friends, families, to read not once but many times the Uluru Statement from the Heart. It's only 1 page long. To understand it and embrace it and what we as First Nations people are seeking, and use it as a catalyst for leadership, change and a better future for us all. Kaya Wanju, Ngan Kwel Simon Forrest Burungu, Kaya Wanju Nijo Wajak Nunga Boja, Nala Boja. Kaya Wanju Nija Karanini Curtin University, Nala Kadich Nunga Mort, Ken Karat Nija Boja, Nan Kadich Nunga Gabali, Borankoria. Budawan, and thank you.
Thank you so much, Simon, for that incredibly powerful welcome, and also highlighting the absolute importance of us to all read and listen to the Uluru Statement from the Heart. I would now like to introduce Curtin University's Vice-Chancellor, Professor Harleen Hayne, to provide us with a welcome message for today's event.
Thank you, Simon, for that very warm welcome to country. Kaya. It is with deep respect that I recognize that we are gathered on Whadjuk land today. I pay my respects to elders and senior knowledge holders of all Indigenous Australians. As a newcomer to this country, I know that I'm still learning. But as the Vice-Chancellor of Curtin University, I am highly committed to teaching and learning in partnership with my Aboriginal and Torres Strait Islander colleagues. And I am eternally grateful for their ongoing support, wisdom, and patience. I'm also committed to reconciliation and the pursuit of voice, treaty, and truth. And at Curtin, we will continue in our fight against racism in Australia. Welcome to Curtin University's annual Human Rights Lecture for 2022. Thank you for joining us in this online format. Established in 2016, the lecture is a key initiative of Curtin's Center for Human Rights Education, providing an opportunity to hear from leading human rights thinkers, activists, academics, writers, and scholars. And what an impressive list of speakers we've had to date. Former President of the Australian Human Rights Commission, Professor Gillian Triggs. Writer, academic, and award-winning Australian broadcaster, Dr. Waleed Ali. Former Justice of the High Court of Australia, the Honourable Michael Kirby, AC, CMG, who is also a patron of our Centre of Human Rights Education. Journalist, writer, filmmaker, and refugee advocate, Behrooz Boochani, who spoke to us live via video link from Manus Island. Lawyer and humanitarian, Dean and Distinguished Bessie Dutton Murray Professor Adrian K. Wing from the University of Iowa College of Law. And last year, we had the privilege of hearing from children's rights advocate, Emeritus Professor Judy Atkinson, AM. Now today's speaker is no exception to this impressive list. A speaker who will be lending her insights to a very important human rights issue. Where to from here? A human rights approach to COVID-19. The COVID-19 pandemic and the unprecedented global change and uncertainty that has followed has deepened pre-existing inequalities across the globe. This growing inequality is particularly the case for disabled people who have been disproportionately impacted in a number of ways. Disabled people, along with older people, First Nations peoples, and people from low socioeconomic backgrounds, are far more likely to experience severe disease and death from COVID-19. While some may be more susceptible to the virus due to pre-existing health conditions, societal factors also contribute, including a lack of access to personal protective equipment and health information. The pandemic has already threatened the progress we have made towards reducing poverty and improving access to education and employment for disabled people. So this year, we are enormously pleased and honored that prominent disability rights advocate and activist Samantha Connor is our speaker. Samantha is the president of People with Disability, Australia's peak cross-disciplinary body, and she has a long history of fighting for the rights of people with disability, holding a number of key roles within the sector. Her current roles include membership in the Federal Women's Economic Equality Task Force and co-convener of the Australians Against COVID Community Action Group. She is also a current board member of the Autism Self-Advocacy Network, AUNZ. She is autistic, has ADHD and muscular dystrophy, and uses a wheelchair for mobility. Samantha has been actively involved in many campaigns and has played a pivotal role in getting the recent Disability Royal Commission established. Samantha recently left her home in Balladong Country, Western Australia, to spend a few years visiting townships across Australia, telling the stories of people with disability and other at-risk Australians trapped in Australia's shadow pandemic. It gives me great pleasure to welcome this year's speaker, Samantha Connor, to present Where to From Here, a human rights approach to COVID-19.
Thank you, Professor Hayne, for that wonderful welcome. And we're thrilled to have you with us today, Samantha, and just going to hand over to you to deliver the 2022 Human Rights Lecture.
Thanks so much, Lisa. And thank you so much, Professor Hayne, and also to Simon for that incredible welcome. 15 years ago, Australia ratified the United Nations Convention on the Rights of Persons with Disabilities. It promised the dawn of a new era, a world where disabled people would no longer be excluded from society, a world where we would no longer be shut into our homes or institutions, nor shut out of public life. We also welcomed Australia's disability strategy, the human rights-based policy that would uphold those rights, and a national disability insurance scheme that would give people what they need to be who they are. And here we are 15 years later in 2022. People with disability are once again in crisis. But this is a crisis like none other, a global pandemic that is killing marginalised communities. Today, there are more than 16,200 dead, more than half the number killed in the Second World War. There are disproportionate numbers of poor people, Aboriginal people, people of colour, and especially people with disability, including age-acquired disability, who are dying at unprecedented rates. And that's not even including excess mortality, which sits at between 12 and 16%. There are other issues, deaths aside. 15 years later, we are living in a time of unprecedented crisis. People with disability have found ourselves exiles in our own country, caged in our homes and shut out of public life. And let me make this quite clear. This situation makes a mockery of the United Nations Convention on the Rights of Persons with Disability. This situation is shameful, unlawful, and abhorrent. We have the right to unapologetically take up space in the world, just as other people do. Let me tell you a story. It's a story about how I became a disability activist. When I was very young, I played with the boys down the road, Murray, Darren, and Barry. Darren was the closest to my own age. We used to steal milk bottles from down the street. That's how old I am. Once he gave the boy next door to me a black eye after an unwanted kiss. We played and laughed and fought from the time we were toddlers. And when we were 11 years old, another boy shot Darren in the back of the neck. He became a quadriplegic, but that wasn't the tragedy of his situation. When Darren became a young adult, there was nobody who could help him with the care that he needed every day. And so he went to live in the Quadriplegic Centre of WA, an outdated old institution in a 12 by 12 hospital room. That's how I became a disability activist. Darren taught me so many things about ableism, disability and segregation, long before my own disability required me to use a wheelchair. More importantly, he taught me about power imbalances. That was the moment that I learned to fight for our rights. It was 1990, and Darren had been at the Quad Centre for many years now. Like me, he was enjoying being a 22-year-old. Darren had been out drinking with some friends, and he toppled in his wheelchair over a curb. On the way back, their car was pulled over by the police, and they used his accident as an excuse to get him to a hospital, as you do when you're 22. But on the way to the hospital, he'd started to feel very sick. It turned out that Darren had broken both of his legs. And that meant that he needed to spend a long, long time in hospital. And so for other people who don't use the wheelchair, it might be a couple of months. It was more than 6 months that Darren was in hospital. And at that time, the Quad Centre had a rule that you couldn't spend more than a few days out of your room. It was a rule that was made to stop people from using the place as a drop-in centre. But even though Darren was right next door in Ward 9, the spinal hospital, they charged him for more than 6 months worth of staying at the Quad Centre, which was ridiculous. When he couldn't pay it, they said that they were going to throw him out. What a completely bullshit rule. Like most rules in disability land, it was based on what a small group of non-disabled people thought. Darren was being forced out of that place to go live in a nursing home with old people aged 22. His families had called ministers, written letters, done everything that they could to stop this happening, to no avail. I didn't know what to do. I was 22 years old as well, but I worked for a powerful man. And one day at work, I burst into tears. He said, "What's wrong?" So I told him. And later that day, he made a couple of phone calls. And by the end of the day, the issue just went away. None of the letters had worked that the family had written. None of the calls. One powerful person made a phone call and it made it all go away. And that's how power works, right? Rules are made by men and they're upheld or discarded by the same men. And rarely are those rules based on our rights, the unalienable rights that we have, which are enshrined within international human rights law. We elect decision makers to keep us safe, to keep all of us safe. That brings us to where we are now, in the middle of a global pandemic, where the rules intended to uphold our rights, to enable our participation in daily life have been completely dropped. What kept us safe? Isolation rules, masks, clean air, online alternatives, social distancing. They worked if you look at the number of people who died over the past 3 years of the pandemic. By far the biggest numbers have been lost in 2022 after isolation, border control, mask protections and density requirements have been lifted. And the impact of those losses of those protections cannot be easily measured. With the abandonment of those protections and a cautionary approach to public health, disabled, chronically ill, and immunocompromised people have been abandoned too. No longer do we have access to the same spaces and places that others have. Once more, we have been cast adrift by society. This is what it looks like right now for people with disability in Australia. We are shut out. We're shut out of education, with at-risk children no longer able to attend face-to-face educational facilities, and university students having to drop their studies as their institutions discard online learning. We're shut out of workplaces and employment. Employers are increasingly reluctant to hire us, and the number of people with disability employed at a time of record employment participation levels for non-disabled people is the same as it was 30 years ago. We are shut out of places and spaces, public transport, places that we have the same right to be in as other Australians. This is discrimination. Conversely, some of our numbers have been shut in for almost 3 years. For those most at risk, the impact of the shadow pandemic and an endless lockdown has been immeasurable. We face a cascade of never-ending negative consequences. The consequence of poor mental health, of lack of access to vital medical assistance or therapy, of lack of support from caregivers. And many of us are unable to effectively self-isolate because we require daily personal care. In a time of widespread COVID, our workers are falling ill to long COVID or are unable to work because of sickness. This is not a hallmark of a decent society. This is what the pandemic looks like right now for people with disability. And what it feels like is eugenics. What it feels like is genocide. It is time and past time for this to end. We need COVID protections and a balance between lives, health, and the economy. It's time for an honest conversation about the social, human rights, moral, and economic implications of Australia's current COVID trajectory. The voices, rights, and agencies of those at risk must be amplified and listened to. The solutions are there, developed by disability advocates and human rights experts. Australia's Against COVID's call for action reads as follows. We call for the reversal of decisions to remove protections, including isolation requirements and pandemic disaster leave payments, along with requirements to mask on planes and in indoor places. We reject the idea that low-paid workers, sick, disabled, and other Australians are able to carry the personal responsibility in a global pandemic. We call for improved, truthful, and coordinated public information campaigns and timely data on COVID, especially the long-term impacts of COVID-19. We specifically urge governments to centre human rights in responses as public health emergency orders are modified or lifted. We urge governments to listen to the representatives of those most at risk. Governments have asked people with disability and immunocompromised people to take personal responsibility for their own healthcare during the pandemic, and this is unacceptable. This requires governments to reciprocate with actions, policies, and modes of delivery that enable people to minimise their risk. We support the position of Aussage, which aims for elimination of uncontrolled transmission with layered whole-of-society protection, addressing safe indoor air, respiratory protection, and optimal vaccination, a vaccine plus strategy. There are urgent priorities for governments to ensure that people with disability and COVID-impacted Australians are supported, protected, and treated with fairness and decency in pandemic circumstances. Current approaches to managing COVID are unfair and impose inequitable burdens on people with disability, the sick, and the old. A political narrative Emphasising personal responsibility is inadequate and problematic within a global pandemic. The impacts of COVID are having compounding consequences on the quality of life of people who shield from COVID. We can't go on like this. We face a cascade of negative consequences, including workforce disruption or failure, supply chain failure, long COVID, disability, disease, and death. Aboriginal people, underpaid workers, people living in poverty, regional Australians, and people from culturally and linguistically diverse backgrounds are disproportionately affected by COVID. We know what works, and we need politicians to summon the political will to make necessary changes and to prioritise the most vulnerable. People with disability have the right to participate in society. We're a signatory to the United Nations Convention on the Rights of Disability, and we have obligations consequential to Articles 11 and 25 of the CRPD. So what are we looking for at this crucial time right now? We're seeking a public commitment from all governments to a goal of ending the uncontrolled transmission of COVID in Australia. Trusted representatives should be invited to address the National Cabinet on the impact of COVID decisions on people at risk, including workers, including teachers, healthcare and childcare workers, aged, disabled and immunocompromised Australians, and people who are unable to be safely vaccinated and those with long COVID. We are seeking a recognition that a failure to provide COVID-safe spaces, places, schools and transport are discrimination against sick, older and disabled people. We're seeking the continuation of key protections, including a requirement to isolate, with requirements for safe indoor air standards and mask use. And we're seeking full data transparency with detailed daily reporting and full disclosure in all at-risk settings, plus releases of all health advice and unredacted minutes of meetings, including all decision-making and the removal of public health requirements with National Cabinet. We need funding and requirements to make sure that public places, including schools, hospitals and community facilities, are safe, COVID safe, that we have safe indoor air and mask use. We have payment and support systems that are geared to ensure low-income and casualised people are not forced back into work while sick. A COVID inclusion guarantee, including a non-contact service framework, including for government agencies like Centrelink, and covering rights to work and study and transact business from home, along with equitable contributions from employers and public authorities to the cost of online access to home-based work and study for those at risk. A removal of obligations, mutual obligations, especially for those who are at risk of severe disease and death from COVID. Access to telehealth for all Australians, including in-reach services and recovery support for NDIS participants and people who are living in congregate settings. A commitment to implement the findings of the long COVID inquiry, as well as clear clinical rehabilitation and referral pathways, and the list goes on. We also need to make sure that we have continued requirements for isolation and testing of all people working in care roles. It's crucial that we are safe at this time. And last but not least, subsidies and full funding for good quality masks and HEPA filters for those who are most at risk, and a national memorial and 1 minute silence in all parliaments to observe those who have died from COVID. We're not calling for lockdowns in the present circumstances. We have to find a balance between the lives, health, and safety of people with disability and the broader public, in line with our goals and aims around making sure that the economy is okay. We are asking that we have a pathway to living again and that we're protected from COVID. COVID is not over. We urge governments to urgently listen and to attend to the consequences of their actions. I'd like to finish off by telling you some stories about people with disability and our experiences in the pandemic. One of the people who has passed away out of the very many that we collectively know is a man named Mr. John Moxon, who has been a personal mentor for me over the past years. John was a quadriplegic and a former racehorse gosh, race car driver. He'd be delighted to say that I just painted him as a jockey. And John was a founding member of People with Disability Australia. John died of COVID, and I remember a discussion with his beloved wife saying that he made his views that he did not want to die, did not want to be euthanized, that he wanted to live as long as hard as possible while he was 9 weeks post the COVID infection in the ward, and yet he died. There have been people who have died of other situations, and they are captured within the excess mortality statistics. One woman is a woman from South Australia named Anne-Marie Smith. Anne-Marie lived in a house and was wealthy, a wealthy white woman who, if she wasn't disabled, would not be dead right now. She died at the start of the pandemic, and she died as a result of neglect and abuse that was perpetrated against her. The registered service provider, Integrity Care, that was supposed to be charged with her care, failed her. The workers stole her jewellery, stole her fridge, and eventually stole her life. She was left in a cane chair to die. And so for a person with a disability who was fearful and there was an excuse for them to be locked in their home for this period of time, Anne-Marie has not been the only person in this circumstance. Many people have died as a result of neglect and of care failure. There have also been other victims of the shadow pandemic who are currently locked in their homes, and some who have been locked into hospitals since the start of the pandemic through failure of care. We need to make sure that those people have been looked after in the pandemic. I pay my respect to people like Craig Wallace, George Talapouros, who has spent a very long 3 years locked down and who are doing remarkably well considering. Do you remember those days when we played that cute little jingle? We're all in this together. When people chalked rainbows in the streets and told everyone how much we cared about community. We have the right to take up space unapologetically in the world. The UNCRPD guarantees us unalienable rights, the right to freedom, life, dignity, and justice. And we as disabled people now reclaim those rights. This Sunday, people with disability are going to converge upon Parliament to make their voices heard and mourn our death at a public vigil. Every day is when I go out and I see a person who is wearing a mask. It's a sign to me that that person cares about me and that they care about my health and they care whether I live or die. I can't tell you how distressing it is when there are tens of thousands of people storming the streets to talk about their perceived freedom, when so many of our people have been locked away, forgotten, isolated, segregated, and left behind. So one of the most powerful things for me is when I go into the street and I can see another person wearing a mask, because it means that they care about me and they care about people with disability. And so I'd urge all people with disability, all people, to make sure that they do whatever they can to keep people with disabilities safe. Thank you.
Thanks, Samantha. Thank you so much for that incredibly powerful lecture, and just for imparting your incredible knowledge and expertise and lived experience in this space. And I think it's incredibly timely, and it also crystallises how important it is to listen to lived experience, people of lived experience, particularly in this context, and how we can best live together. And it really highlighted to me, that there are structural cases that causes that vastly disproportionate, that vastly impact disproportionately different people in our community. And thank you for being the presenter of our annual Human Rights Lecture for 2022. It's just been really wonderful to have you here, and a big thank you to Emeritus Professor Simon Forrest for his welcome to country, and Professor Harleen Hayne for her welcome to Curtin.